And for a lot of us out there, maybe you've even been to a doctor or a clinic that specializes in hair loss. Well, this is not only an FDA cleared product, it is #1 doctor recommended, the same technology to regrow your hair. Men and women alike. Men and women alike. Hair loss does not discriminate these days. And a lot of us just kind of throw up our hands and we say, what are we gonna do? But the genius behind this is twofold. Not only FDA cleared technology and of course recommended by doctors. This is not only a system that has been clinically proven to show results, but it is also taking you less time. So you simply put on the cap, and I'm just gonna bring out Barry, the big brain on Barry, because you used to deal with clients and
exactly
in offices where, you know, we always have to be very specific about what we say, who came to the practice with very specific issues. And normally to do something like this is the lowest price we've ever offered. Usually labor intensive, you're driving somewhere else, you're going to a doctor's office.
Well, and people used to pay like 80 bucks a pop to go to their doctor's office to get their treatment. And it is true that I did work for a very large medical facility where it was my job to meet with these men and women and tell them what they could do about their hair loss. First, explain why they were having hair loss, which we'll talk about, and then tell them their solutions. And that's why I'm so excited to talk about this biomedical technology that you used to have to go to a doctor's office to get this medical treatment, and you can now do it at home for 6 minutes once a day. But Shannon, the most important thing I can say this entire night, if nothing else, and I'm excited to educate you on everything there is to talk about, but that is that it is FDA cleared. That means everything.
Absolutely.
Everything.
By the way, and I love that they created a graphic for this, because I must have asked Barry and his team 6 different times, 6 different ways, 180-day return policy, $180 return policy, lowest price ever here at HSN. Very, very limited as well. In fact, one of the reasons I've never had the pleasure of presenting this is it sells out every time that it's been here. It sold out the last time you were here. Barry only has a couple of shows. Now, remember, you are getting the device that you wear it like a cap. I'll have Barry, take you on a tour of how you use it. Remember, it takes less time. You used to have to wear it, what, how many times?
Like 30 minutes every other day.
30 minutes every other day.
Now it's 6 minutes once a day, and you're seeing what's happening here.
Perfect.
I'll explain this in more detail, but this is a very specific color spectrum of light that is going to reach down to your follicles, what a lot of people call a root. It's actually going to stimulate the cells in that follicle to bring it back to life. So it's important to talk about a couple things. #1, there has to be a follicle there. We don't want to mislead people that medically, if you're completely bald, there is no follicle there to reverse and bring back. It must be there. But to what Shannon mentioned earlier about the 180 days, why 180 days? Because we're talking about growing real hair. Look, guys, I get it that you've read things and spent the money and you feel totally ripped off. You heard about this, you spent the money and feel totally ripped off. I understand the pain of wanting to do something and wanting something that's real. 180 days, Shannon, because this is real. We're really growing hair.
They're growing hair. We've got a lot of support. So we've got some before and afters. We've got some videotape from someone you might recognize. And, well, actually, from 2 someones you might recognize. But Barry, talk a little bit about this, because this is pretty common.
Yeah, so this is Daniel, 6 months. Now, look. You're noticing 2 things right away. First of all, you're saying, oh my gosh, he has so much hair, which he does. But you know what, Shannon, it's important to notice that he stopped losing in the first place. The reason people would come into a medical office like this is because I'm losing my hair. Well, here's the good news with this biomedical technology. We can not only stop the loss, we can cause regrowth, like we saw in that animation.
Grow hair.
We can take that healthy little hair that's about to die and bring it back. Now, this is Yvonne. Now, again, right away you're noticing, look, Yvonne's part, look, it's so wide there, and look, I can see how it's filling in. But notice 2 things. #1, Yvonne stopped losing. But look how thick thicker the sides are, and
Good
look
point.
at the shine and the health. You're not only gonna regrow hair, you're gonna regrow healthy, vibrant hair.
Healthy,
permanent.
Permanent.
Yeah.
I mean, because, and then, oh, now, so this is actually at the back of the head. So where, you know, you put the cap on,
Yeah,
right?
and this is Lester, the same situation.
Right.
He grew hair in what we call medically his vertex. Now,
okay.
I think this is a good time for me to address. I understand someone may say, okay, hold everything.
Well, hold the phone, Barry.
Why don't you have hair here? No, this is the thing, guys. I don't have hair here because this didn't exist 20 years ago when my hair was falling out.
Right.
But can I tell you something?
Yeah.
My family members, again, all the men and women that I talk to this medical technology about, I want to get them on there as quickly as possible because the clock is ticking.
Yeah, you're right.
The hair is dying, and in a little bit I'll explain exactly how that happens
Absolutely.
if the hair
because,
dies.
You know, the only thing you
I
have,
wish I could have it.
right? I mean, isn't that true? And because the only thing you have to lose is more hair. I mean, at the end of the day, the only thing you have to lose is more hair. $180 or a 180-day return policy, lowest price in history, a little over $280 in your credit card. You get that great. I love the customized carrying case that comes with it.
People love to travel.
They do, and you know, comfortable, easy cap design. You charge that battery when you first get it at home. I'm going to Barry take you on a tour. We're going to show you off our model as well. But you all know Martino. He was actually here, well, ironically enough, with Gabor Wigs. And who knew, you know, I didn't know that Martino is a huge fan and user as well. He's had incredible results, but he always has something to say. So I'll let him tell you himself.
My name's Martino Cardi, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin, and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money, and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
I like that. He said it all. I mean, Barry, this is not only clinically proven, FDA, you know, doctors recommend it for crying out loud.
Well, and I mean, think about this. Martino has access to everything.
You bet.
And this is what he chose. He mentioned that he goes to the best doctor who deals with hair. And his doctor told him to use this.
Right.
A few weeks ago, I was at the AAD convention because I work with doctors every day, the American Academy of Dermatology, 10,000 strong, talking to them about this. If you go to your doctor, he or she may likely say, use this.
Right.
The good news is, it's easily available for you here today.
And it's the best price ever. So, you know what, we got to put our model to work.
Oh, yeah, I know, right?
Should we do that?
Mary's over there. Yeah, let's show this how it works to Mary.
Let's do this, okay.
We'll go over there, and I can explain how hair loss happens in the first place.
Sounds good.
And specifically, how Capillus works.
Okay.
So, Mary's going to use her cap. Okay, I'll go on this side here.
All right.
This is my personal cap that I can use, and see, it goes on your head.
Right.
But let's have Mary show you exactly how it works. So, Mary's going to place it on her head. There's one button. If you see Mary has her finger on one button, it's one button operation. She's going to tap it. Did you hear that beep?
I did.
Okay, now the cap is on. If you take a little peekaboo, the treatment has begun.
Okay.
It will go for 6 minutes, and the computer chip in the cap will regulate that treatment and automatically turn it off after 6 minutes.
Oh, no kidding.
So, a good idea is to do this the same way every day. So Mary may want to do this right out of bed. That's when I do it. I get out of bed, I have to grab a cup of coffee. I think Martino even said that.
He did, yep.
I check my email, my social media, and that's when I use it. Mary may want to do it before bed when she's reading her book.
Okay.
She may want to do it when she's brushing her teeth. 6 minutes, once a day, and the treatment is going.
Wow. So what causes that hair loss? I mean, I guess we're dealing with a lot of different factors
and
here.
again, this is what I would have to explain when people would come into the office. So let me explain to you exactly how hair loss happens, okay? We're born with healthy hair.
Right.
Full, thick follicles, again, that a lot of people call roots. What happens in baldness is that healthy follicle starts to die, and it gets smaller and smaller and smaller, called miniaturization.
Okay.
That's the medical term, until it's gone.
Oof.
When that follicle is gone, that is permanent baldness. That's why the clock is ticking. You hear things,
Right.
people say things like the follicle's closing or it's resting. No, that follicle is gone. That's permanent
Wow.
baldness. So what do we want to do? We want to find a medical way
Right.
to treat that follicle before it dies, stop it from dying, and actually make it healthy again. So what we're going to do is use a very specific color spectrum of light, the very specific red light that you can see under Mary's cap.
Nice.
That red light will actually go through our skin and our hair.
Oh, wow.
What it's doing is it's stimulating the cells, or specifically, let's go back to science class, the mitochondria in those cells,
Okay.
the energy levels of those cells. And all of a sudden, this follicle was like, oh, wait, I don't have to die.
Right.
This is exactly what I need. I can become healthy again. So that miniaturized follicle gets bigger and bigger and bigger and bigger. That's how, like you saw on those before and afters in
Wow.
Daniel's, hair regrows. Again, not snake oil,
Right.
not temporary, a solution, a medical solution to hair loss, which is why that 180 days
It
again.
is.
You need
Don't
to give it a
forget,
chance.
lowest price ever, clinically proven, FDA cleared, medical device, recommended by doctors. Lowest price we've ever seen, $180 return policy. So who can use this and what can I expect?
Okay. FDA cleared for men and women.
Men and women.
This company, Capillus, I'm very proud to say, has 7 FDA clearances.
Wow.
That's huge.
That is huge.
Cleared, FDA cleared for men and women. Now, what you're looking at is the hair loss classification chart. That's called the Norwood scale in the medical industry of hair loss, okay? You can see at the top that 1 and 2, these guys don't really need to do anything, they're
Yeah,
fine.
right.
Now, look at all that blue. These guys still have follicles floating around, okay? That can be reversed and stopped. This is perfect for those guys. As we get to the bottom, it's not that they can't use it, they certainly can to stop, because hair loss is progressive. Most typical kind, androgenetic alopecia. Andro, human being. Genetic,
Okay.
we inherited alopecia, hair loss. Now, if we look at the women, this is called the Ludwig or the Savin scale. You can see where the hair, typically the part gets wider and wider and wider and wider. Now, any of these ladies can use this and see amazing benefits like we saw in our before and after. What we don't want to do is, you see that white box at the bottom, we don't want to mislead people that if there is permanent, shiny baldness, that something's going to change because that follicle is gone. However, those ladies can certainly stop the loss where it is and regrow some.
Absolutely. Does your skin tone matter?
There's something called the Fitzpatrick scale, and it really doesn't.
Okay.
We can say a couple of things in terms of the FDA. Number one, there are no known side effects. Huge.
That is huge.
Because there are things out there that you can possibly do that there are known possible side effects.
Right.
No known side effects with LLLT.
Wow.
If we look at the Fitzpatrick scale that we also have available, you will notice that it has only been clinically tested on some. It hasn't been clinically tested on the darker skin. That doesn't mean it won't work.
Right.
That just means the clinical trials have not been done on that, and if I can add personally, yet. Because this is huge. And again, as you look at Daniel, again, the loss not only stopped, but regrowth happened.
Regrow.
And you know, it might be interesting for folks to know, and then we can go back to Mary, but on your sister network here, QVC, there's Dr. Deness is well known for an excellent skincare.
She is.
Well, did you know that Dr. Deness is a Capillus user?
I did not know that.
Yes, yes. Now, this is a medical doctor and a PhD.
Yeah.
And you know what she loves most about the Capillus, aside from the results?
What?
Is exactly what I talked about, being FDA cleared. Let's listen to Dr. Deness talk about it, then I'll explain specifically what she's talking about of why she loves it. It's FDA cleared.
My name is Dr. Adrienne Deness. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
Okay, wow.
Yeah, I know, right?
Wow.
Yeah, I mean, this is a smart lady, and she's choosing to use the Capillus.
I know. So, you know, I think a lot of people get curious. We do not say FDA cleared lightly.
Oh my gosh,
So that's
no.
like a big, big deal in and of itself.
Huge. Okay, so let me explain what that means.
Okay.
And you know why? And I explained this to the men and women that I would meet with to talk about hair loss because it answers a barrage of questions.
Sure.
In order to be FDA cleared, the FDA has to be satisfied that this technology is two things. Number one, effective. They call it efficacy in the clinical trials.
Right.
If this product is not effective, the FDA does not clear that technology. Second, the FDA has to be satisfied that this product is safe. Think about that.
Yeah.
So not only effective, yes, it works, but safely it works. That's why that FDA cleared seal means so much.
It does. So now this is actually how it works, this little animation?
Yeah, okay, so, oh, good. Now, this will make a lot more sense. Remember we talked about miniaturization.
Yeah.
So what's happening is that follicle is miniaturizing and getting smaller and smaller and smaller and dying. Here comes that very specific spectrum of light. Light equals life, just like photosynthesis in a plant. It's stimulating the mitochondria in that stem cell, in the cells of that plant. Okay, there it is. So we see it dying. It's getting smaller and smaller. That's where it's approaching baldness. But look, we're catching it in time before that happens. And now those tiny baby fine hairs, or that thinning hair, is reversing.
Oh, wow.
And it's growing back into its full healthy state again.
Well, I got to tell you, I mean, you see these before and afters. First of all, that's real life. If you're
It's
seeing that in the mirror,
real hair.
that's real hair.
Nothing tricky about it.
Nope, that is real hair. A lot of women see this and they think there's nothing they can do about it when they start to see that part start to widen.
Exactly. And they think they can just do cosmetic things like a cover-up, a root, a dye. That is simply not true.
Right.
You can actually stop the loss and reverse.
Yeah, and you can stop the loss and reverse
and regrow hair.
And regrow hair.
Those follicles can be reversed.
And you have to say again the difference between the time it used to take and the time it takes now.
That's right. Now it's only 6 minutes a day.
Wow.
And we did that as a company because in the medical industry there's something called compliance, meaning people will do it. The best pill in the world is no good if you don't take it.
Right.
So, you know, in our crazy society, 30 minutes every other day, people are like, I don't have 30 minutes. I was like that. But when we went to 6 minutes once a day, compliance went way up and people did it. And if I can have Mary show you, I'll show you how easy it is.
Okay.
One button operation.
One button operation.
So Mary wants to use it. She's going to tap that button once, bam. The cap is on.
Yep.
In 6 minutes, it turns itself off. Mary does that 6 minutes once a day. She will start seeing in about 3 months, maybe, oh, look, I'm not losing my hair.
Right.
In about 6 months, Mary will look in the mirror and go, wait, I think I'm regrowing hair, which is why we give you 6 minutes, 6 months to try it.
Absolutely. So 6 months to try it. Remember, and that kind of matches our flex pay, ironically enough. So lowest price ever, $283 and change on your credit card, 180-day return policy. So we all know who we are. And the thing is, we struggle with that hair loss, whether we're men, whether they're women. And isn't it gratifying to know that there is an FDA cleared, clinically proven